Welcome to the Expert Series, brought to you by the Lupus Foundation of America. Our health education team is here to bring you experts in lupus to discuss topics to help you live better. My name is Ian, and I'll be your host. Thank you for tuning in to today's episode, brought to you by AstraZeneca. We are grateful for their support in helping us continue to bring you high-quality educational programs. In this episode, we are very excited to welcome Dr. Cindy Aranow, who will walk us through the newly released American College of Rheumatology treatment guidelines for systemic lupus erythematosus, SLE. Because everyone with lupus is different, finding the right treatment approach can be challenging. Dr. Aranow will explain how these guidelines were developed and how clinicians use them to guide treatment decisions, giving you a head start on conversations with your doctor and helping you make informed decisions about your care. Dr. Aranow is a professor of medicine and of molecular medicine at the Feinstein Institute for Medical Research, Hofstra School of Medicine in New York, and she co-directs the Feinstein Lupus Center of Excellence. Dr. Aranow received her medical degree from New York University and completed her rheumatology training at the Albert Einstein School of Medicine in the Bronx, New York. She is a recipient of the American College of Rheumatology Edmond Dubois Award in recognition of her research in SLE. She has also received the Collaborative Women in Science Award on 2 occasions from AWSM, Advancement of Women in Science and Medicine. We are delighted to have you join us today, Dr. Aranow.
I'm delighted to be here. Thank you.
So let's start with the fundamentals. When we talk about treatment guidelines, what are they, and how do clinicians use them in day-to-day care?
So, treatment guidelines are just that. They're guidelines to help healthcare providers give state-of-the-art evidence or evidence-based guidance on how best to treat a condition. And today we're talking about non-renal lupus. So it's important to add that they aren't mandates or requirements. They can be viewed as strong, very strong recommendations. But again, they're recommendations and not legally binding. I think it's also important to remember and to mention that the guidelines do more than recommend drugs or treatments to use. And maybe they should be called guidelines for SLE management, as they include recommendations on monitoring disease, comorbid conditions, things like bone health, recommendations on vaccines, atherosclerosis, cancer screening. So they aren't just treatment, but these are clearly important part of taking care of patients with lupus and need to be included in management guidelines. And the ACR guidelines do include them as areas that are important and to be included in lupus care.
Thank you for helping to contextualize and kind of kick off this discussion. To follow, why are treatment guidelines especially important for a complex and highly individualized disease such as lupus?
So lupus is a heterogeneous disease, meaning that it's different in each person. Each patient is unique. And as you mentioned in the beginning of the introduction, choosing the right or best treatment can be really, really challenging. So the guidelines help make sense of all of the information, good and bad, old and new, that's out there. They provide recommendations based upon research data, expert opinion, and importantly, input from patients living with lupus. They make it possible, no matter where a patient is, whether it's an academic practice or a rural clinic, that a patient with lupus is going to receive the best possible care, that the care is consistent across healthcare settings, and that then the patients have the best possible outcomes.
Perfect. Thank you very much for helping to give us an idea of why these guidelines are important for people with lupus. To continue, can you talk a little bit about who is involved in developing lupus treatment guidelines and why that mix of expertise is important?
The guidelines were developed using a really structured and formal methodology. So there was a core group that led the guidelines, a literature review group, a voting panel, and a patient panel. And rheumatologists, adult and pediatric, were involved, dermatologists, actually a physician assistant, as well as patients. And these were all involved in developing the guidelines. And actually, 2 of the patients on the patient panel were also on the voting panel. And so the mix is really important to ensure that all and different viewpoints are present, that each individual could give different priorities and experiences, that these can all be heard. And I also want to mention that the staff from the American College of Rheumatology, the ACR, were also crucial in helping to keep the process fluid and moving.
Perfect, thank you. To continue here, can you talk a little bit about how the treatment guidelines are updated, whether it be reviewing evidence to releasing the final recommendations? How are they updated over time and as more information becomes available?
So I think it's important to know that the previous ACR guidelines were more than 20 years ago. So this was almost starting from scratch, and a lot has happened in the last couple of decades. And in fact, the methodology has become much more strict and formal. So I'm going to try to be brief with this. So the core team met and developed a number of really detailed questions. There were 65 questions actually, and each had multiple sub-questions. And these were related to all aspects of lupus treatment and management. They then gave these questions to the literature review team, who did a comprehensive lit review looking for any published data that could help shed information on the specific questions. And then the lit review team would then grade the quality of the data from very low to high, so that, for example, a randomized, double-blind, placebo-controlled clinical trial studying a large number of patients would receive like a really high grade, but a report of how a single patient did when they were given a treatment, although it was clearly important, would have received a lower grade. And an extensive file was created called the evidence report, and then the evidence report was given to the patient panel, and their perspectives and preferences were given to the voting panel. Two of the patients were also on the voting panel, and next, the entire voting panel reviewed the evidence and discussed all of the information that was given, taking everything into account, and they voted on the recommendations that came through on these initial core generated questions, and voted yes or no, for or against, and then also gave the strength of the recommendation, either strong or conditional. And there actually needed to be a 70% agreement on each recommendation. And I'm just going to just mention that this review, this discussion actually occurred over several days. It wasn't just something that came and went. So this guideline is actually thought to be a living document, so that rather than wait another 20, 30 years for new recommendations, it's expected that as new information comes out, that the recommendations will be updated and looked at again.
Perfect. Thank you for helping us to understand how they're developed and how they're updated. From your perspective, in the ACR's recent released updated guidelines for SLE, what are some of the most important changes patients should know about?
So there are a lot, but I think that one of the most important changes are the explicitly stated goals of therapy. The guidelines now advocate that the target of treatment shouldn't just be that a patient feels a little better, but that the goal is now optimum control of disease activity. The target is remission, which is absence of any clinical disease activity, or if this can't be reached, then a state of what we call low clinical disease activity. So related to this is the goal is to reduce morbidity and mortality. And a third really important goal is to minimize toxicity of treatment. So, these are important because achieving these goals are going to lead to decreased damage from lupus and better quality of life. And in order to achieve these goals, the theme is now to be aggressive when the disease is aggressive, with steroids and second-line agents when they're needed, but less is more. And so then to try to reduce exposure first to steroids and then, when possible, to the second line conventional agents or biologics.
Definitely, thank you. You mentioned therapy. The guidelines emphasize escalating therapy when lupus isn't adequately controlled. Can you talk about what that means for patients who feel their treatment isn't fully addressing their symptoms?
So this is a really important question because communication between a patient and the healthcare providers is critical. So yes, the guidelines state over and over that therapy should be escalated or changed when lupus disease activity isn't adequately controlled. But it's super important to realize that not all symptoms that a lupus patient feels are coming from their lupus are actually coming from their lupus. And so it's important that a patient with lupus communicates and lets their healthcare provider know what symptoms that they're experiencing. But actually, one of the most difficult parts about taking care of patients with lupus is determining if a system is of lupus activity or not. So I think it's important always for the healthcare provider and the patient to be talking, to be communicating, and we call this shared decision making.
Gotcha, thank you. In addition to therapy, one of the strongest messages in the guidelines is reducing long term steroid use. Why was this such a priority, and what should patients understand about this shift?
So I think we have a love-hate relationship with steroids, and that although steroids have immediately uh, are beneficial, they come at quite a cost. And we know that they're directly related to lupus damage. And long term and at high doses, they cause diabetes, bone loss, high blood pressure, mood swings, weight gain, cataracts, skin changes, high cholesterol. I mean, I could go on and on and on. And this is just to name a few. So, though lower doses are associated with less side effects than higher doses, we now realize that even low doses can cause problems and that the goal should ultimately be to get off of them, to get to zero. So this means that second-line drugs are very likely to be used to help to get the steroids reduced and then off.
Perfect. Thank you very much. If we could, going back to the themes of individualizing care and the patient's role, we know that lupus looks very different in every patient. So, how do clinicians balance guideline recommendations with individual factors like disease severity, other health conditions, and patient preferences?
So that's also a really important point and question. And the guidelines actually don't say, you know, and mandate that how to incorporate everything because well, each patient is unique, and the guidelines help with treatment decisions for an individual patient with his or her individual disease features and with their patient preferences. And it's not that one size fits all. And in fact, this is really important because there were 36 guidelines and practice statements that came out. Only three of them were given strong recommendations, and the other 33 were conditional. And more than a single treatment is suggested. So there's no one best treatment for every single patient. So it leaves lots of space for shared decision making and an opportunity to select with the patient the right thing for a given patient, the treatment that's best tailored to a specific patient's needs, and that would include disease severity, other medical conditions, and what a patient their views and their preferences on the type of treatment that they would best like to receive.
I see. If a treatment isn't working or side effects are affecting daily life, how do the guidelines support revisiting and adjusting the treatment plan through shared decision making?
So the guidelines definitely support revisiting and adjusting treatment if something isn't working. And they actually do recommend that disease activity be monitored regularly particularly when patients are being initiated or tapered, they actually make the recommendation that damage should be monitored every year. So the guidelines are definitely saying that to keep in touch with your patient and to make adjustments as things may change.
Okay, that makes a lot of sense. If we could kind of pivot into my final couple questions here, I want to ask about what patients should know and what they should take into their next visit. Oftentimes, patients may never hear the word guidelines during an appointment, but based on these recommendations, what are a few practical questions patients can ask to be more engaged partners in their care?
So that's a really important question and point because patients need to be more engaged. So I think it's important that patients realize that there are treatment options, that there's not one best way to, or treatment that's out there. So it's important that patients ask, what are the treatment options? What should I expect from the different options? How likely am I to respond? What are the side effects? How likely are these side effects are likely to occur? Do I have any things particular to me that might make me more or less vulnerable to a given side effect? And then the other thing to realize or to ask about is how long is it going to take before a treatment may have an effect? So, I mean, I think that it's really important for patients to be as informed as they possibly can and to become partners with their healthcare providers as they go along their patient journey.
I think that's a really key point, being proactive and engaged in one's care, because as we've talked about and heard in this discussion, oftentimes lupus impacts individuals in very distinct ways, and so being able to be an advocate for oneself is so important. My final question here, if there are one or two key takeaways you want people living with lupus to remember about the guidelines, what would they be?
So I think one really key, I'm going to say, point is that we're at a time that we're talking about remission, we're talking about low disease activity. These are possible, they're attainable. We've gotten the tools that we have to treat lupus are much, much better and are out there. I think it's also important to remember and to think that don't be afraid to take away your steroids. Everybody wants, them lowered or they want to be off, but, there are many patients out there who are afraid to take it off. So that's also important. But I'm going to then just reemphasize that it's really important to become involved, to become engaged, to ask questions, that, it's really important to have communication with your healthcare provider. And these are really exciting times. I mean, I think that these guidelines were a long time overdue. And I think that it now gives us a new set point and it just reframes where we should be.
I think that's a really important point as we wind down this conversation of understanding obviously lupus can be a really debilitating disease, but there is optimism, there is reason for hope. And I think understanding how these guidelines have evolved over
Mhm.
time and where they are now is really important to that conversation. And it sounds like you are quite optimistic about where we are.
Absolutely. I mean, I think that it's really exciting. We have new drugs. We know how to use these drugs well. We know how to use our old drugs better. And this is not the purpose of this conversation, but there are a lot of things in the pipeline. There are a lot of really promising medications and approaches that are out there. And I think that the next couple of years are going to be really exciting and a time of tremendous growth for what we can offer to our patients with lupus.
That's really wonderful to hear. Thank you so much, Dr. Aranow, for your time today and helping us understand the new lupus treatment guidelines.
Thank you for having me.
We'd also like to say thank you again to AstraZeneca for their support of this program and people with lupus. For those listening in, You can find more information on lupus from the National Resource Center on Lupus by visiting lupus.org/resources. To listen to additional episodes of the Expert Series, you can visit lupus.org/the Expert Series, where you can also subscribe to get alerts when podcasts are released. If you would like to connect with one of our health education specialists, you can go to lupus.org/health educator or call 1-800-558-0121. And finally, to connect with others with lupus in a supportive and understanding environment, I invite you to check out our virtual and in-person support groups. You can find out how to connect with the right support group for you at lupus.org/find support near you. Thank you so much for listening.